It is 8:41. Cleveland Clinic announced today it's rolling out an artificial intelligence tool across its Ohio and Florida locations to help identify a deadly infection much earlier. Sepsis is a life-threatening emergency that kills thousands of people each year. And better to explain how AI can help, senior health correspondent Monica Robbins joins us now live with more. Hey, Monica.
Hey, thanks, Dave. Yeah, chances are you know someone or are familiar with this life-threatening medical emergency known as sepsis. It's an insidious infection, often difficult to diagnose in time. And joining me now is Dr. James Morrison, the chair of the Cleveland Clinic Sepsis Committee, who helps guide sepsis protocols. And as an expert in critical and emergency medicine, I'm guessing you see this more than most doctors, right?
Yeah, I work in the emergency room and also where critical care and life support is provided. So I'll see sepsis when it walks in the door and all the way through the hospital.
So you and I were talking earlier. Most people think sepsis is an actual bacteria or virus, if you will, but it's not. What is it?
Sepsis is difficult because it's often caused by a bacteria or a specific infection, say in the lungs or the urine or the skin. But what really causes sepsis is the body's response to infection, kind of a runaway process that causes inflammation.
So it's a catch-all term, actually.
Yeah, there are many different causes, but the overall process and the damage that it causes, we've learned to identify that.
So what can it do?
You know, sepsis can cause all sorts of problems, and the biggest problem is that the body can't get the right blood supply to the organs, and you'll see them start to fail. And so where the organs aren't working, you'll see the specific symptoms of that, like confusion for the brain, difficulty breathing for the lungs, decreased urine if it's the kidneys. You kind of have to be specific about which body system's affected.
So I would assume this is very difficult to diagnose as a one-time thing. A red flag pops up.
It's a huge challenge, and really we've learned over the years that it takes a lot. It takes us staying on top of it and having a mindset to find this and like a level of urgency to act quickly. We really have been emphasizing treating this at an emergency at the same level as a stroke, a heart attack, because of the impact it has on our patients in the community.
But do most patients come in because of something else?
Yeah, it can be anything, and that's really what can be so challenging. They may present with a specific symptom, and our doctors have to learn to sniff it out and have a suspicion for it and act early to treat it.
So what will AI do?
Well, I think AI really has the opportunity to look at vast amounts of data and to sniff out that signal and elevate it to the provider. So really this is about taking that large amount of data, processing it, and then connecting it with the expertise of our providers.
So even if the provider is looking at, say they come in with the flu, the AI is going to like let them know, hey, ding, ding, ding.
Yes, the provider could be focusing on their specific symptoms, but the AI might take a look at the data and say, I'm getting a signal that this patient's at high risk. Can you take a closer look for sepsis?
And then what do they do at that point?
Well, the good thing about this program is it's called Provider in the Loop, meaning the AI is going to surface it to the provider and then it asks them for their input, and the provider will assess the patient, and they can give the feedback, and the system will learn from it as it goes. So that it's not AI alone, it's working together. So
at that point, can they just give the patient antibiotics at that point and stop it in its tracks? Is it that simple?
The most important thing to do is control the infection. Antibiotics are a key part of that. And if someone's very sick, we will give antibiotics as soon as possible.
So a lot of people think that you get sepsis in the hospital. Is that true, or do you get sepsis anywhere? Sepsis
is a spectrum, and it develops over time. The sooner that you're able to recognize it and act, the better your outcomes are going to be. So if you have a suspicion that you're getting sick, particularly if you're exhibiting symptoms like confusion or starting to behave abnormally, it's time to get checked out. It doesn't develop specifically in the hospital. In fact, getting there sooner can help prevent it from happening.
And there's not a blood test that will tell you if you have sepsis or something?
There are blood tests that help us understand the overall picture, and my life would be a lot easier if there were a single test that could help nail the diagnosis of sepsis. For better or worse, it's a bunch of different factors, and that's why we're working to bring tools like AI into the picture so we can do a better job finding it.
Final thoughts. What do you want patients to know?
I want patients to know that sepsis is a life-threatening medical emergency, that if you are exhibiting signs or worried about a loved one, you should head to the hospital to get evaluated.
All right, Dr. Morrison, thank you so much. I think we're going to see a lot more of AI tools popping up everywhere in the future.
This is definitely coming, and Cleveland Clinic's excited to have this tool and to start working in this sort of area.
All right, thank you so much. Dave, back to you.
Wow, that is fascinating, Monica. My goodness, what AI is doing, and we just learned a lot there. Thank you so much.